I'm Paul Gregory. I'm sort of live on location at, we've just rebranded. Our name is now Support House, which we figure captures more of what we're about in terms of being a hub around resources, mental health and addictions resources for youth to seniors. So I'm live now at 599 Chartwell, and this was the first location. So I'm just going to reverse the camera here and try and give you a little bit of an idea of where we're at. So this is we just built this. It's a safe bed site. We built it in conjunction with our police partners, CMHA, our addictions partners, ADAPT, in combination with the region of Halton. And so this is a safe beds project, which really works with some of the most marginalized people as they come off the streets, out of hospitals and so on, and are provided crisis supports and supportive counseling. I'm going to throw it over to Jeremy at Grace House.
Hi, everybody. Again, thank you for allowing us this opportunity to give you a Blair Witch Project Season 3. So I'm just going to flip my screen. I'm hoping everybody can hear me. I'm just outside to give you a bit of a visual of what Grace House program looks like. So the Grace House program has been around since 1974, and it's been on successful in terms of a transitional house for individuals with mental health and addictions. We established, it came to Support House about, I'd say about 8-9 years ago. We inherited it, and this will be a little bit more quieter for everybody. So I'm just going to give you a quick visual tour of it. So here's our office space where staff are here 24/7. It's usually just one staff during the day, and then night it does have some extra supports that come in. A lot of community partners also end up stopping by and provide some additional support to staff and residents. So again, this is a 10-bed congruent living space where we do have 5 beds specifically for females, males, transgendered. There's the kitchen where a lot of the support and a lot of the work happens. And I'm actually going to take you just for a quick tour just to go and see one of the actual bedrooms. So we do have an upstairs and a downstairs lounge for folks. And part of the interesting piece about Grace House is that it used to be a transitional house for up to a year, where now we've actually increased it to 4 years to give more time for us to do the work necessary to transition folks on, to get the better life skills, employment. So here's one of our rooms. There's much more to it, but I want to ensure that I do not wake anybody up and not disturb anybody. So I'll give you guys back to Paul, and thank you for this time.
Thanks, Jeremy. I just wanted to show people one of the visions for our Grace House site. During all of this, our group pivoted really quickly. We were deemed an essential service quickly on, and so we were still doing face-to-face visits as we were sort of learning the new pieces around PPE and masking up and gloves and all of those contingent pieces, component pieces, and developing our protocols on the fly, really in conjunction with Ministry of Health, but really on our own to some degree for the first little while. As you can imagine, there's a certain amount of anxiety with staff and with residents in our congregate settings, and so really moved quickly to continue our face-to-face work with clients in the community, and continue our, obviously at Grace House, 24/7 supports of people in the residences. So challenging times in the first couple of months as we navigated through that. Our peer groups through the Center for Innovation and Peer Support also pivoted and are now doing groups virtually and actually reaching many more people than we used to in person. One of the things as a system our we've been discovering as we redid our strategic plan and rebranded is that our real value adds to the system are around housing, because that kind of stock is necessary and a pivotal piece for people to get back on their feet. The second is really around our peers, because we know the efficacy of peer supports and people who have walked in people's shoes and beside them really provide some of the best supports. They can identify with the issues, they can relate, and they're more empathetic to people's experiences as they walk beside them. And then the last piece is really around the grit and teamwork of our community supports, the fact that we're working with some of the most people with the most multiple needs, complex needs across the system, and face the most barriers to getting supports. And so those are really our value adds to the system. And in our rebrand, we're trying to really articulate some of these pieces. But here's our proposed Grace House site. So right now, Jeremy, I think, was showing you the outside of the building. It's 10-bed congregate setting. And so we're looking at, with COVID, obviously, the move towards self-contained private units for individuals so much more important now than it was. If you've seen, we've all seen the challenges in long-term care and congregate settings. So this is our proposed project that's already at the pre-development stage. Exciting. We're trying to continue the same vision that the families had in 1984 to now, to build more and be more visionary in terms of what we can do around affordable and safe supportive housing. So that's one of our visions for the future, is $15 million project that we're trying to get underway. Town of Oakville has been really, really supportive, and as is the region of Halton and CMHC. So we're hoping to get that off the ground in the next little while as we move. I'll throw it back to Jeremy for the last piece, vignette of a story of one of the individuals we support.
So this is one of the exciting pieces I've been able to work with United Way in my history with you guys, is providing some impact stories. And typically I've done it for young people that are coming through our program. So for Grace House, one of the individuals that we supported that came through back in March of 2019. So it's just been over a year and a half now, but this individual actually came from the Halton Hills area, where he was going through a lot of significant traumas with family, substance use, undiagnosed mental health, where when he came through our programming, we were able to admit him in, I think it was March, it was the actual month, where it was really challenging for him to, one, be living within a congregated living setting where he was kind of homeless, now all of a sudden living with 9 other people. But he really walked along staff, and staff really provided that additional support to get him connected through financial pieces, as well as just to give him a voice. And that was one of the most important pieces, is that he all of a sudden realized, I now have a voice in my care and be able to kind of dictate how my care needs to look like. With a roof over his head, he was able to be very successful. And then in the first probably 6 months, when he got his feet, under him, and he got some of the clinical interventions and some of the peer supports that he got, he actually wanted to give back. And this was the interesting piece. We actually, he ended up being one of our house ambassadors. So he would go out there and either do some speaking for us, and also would be very much a huge part in focus groups, where he would provide a lens of understanding from a peer lens and a service recipient to understand how we can actually evolve our program and service delivery. So it's been a really good time and a really successful piece. He does bring up his traumas, but oftentimes, but the beauty is that he actually now is comfortable in talking about it, and that support, and also bringing in additional services to talk. So more, it's a collaborative approach. So again, since his time now, in the last 7 months or so, he's also been doing part of our social enterprise program, where he'll go around and provide lawn maintenance care to our Hydro One cuts, and as well as all of our other owned properties. And in addition to that, he's also our fire safety guy. So he will also go to all of our other houses and do fire safety checks. So it's interesting that there's a level of trust that he has for us, in addition to what we have for him. So it's been a really good good time in terms of relationship building, but also really recognizing from where he came to where he is now. And this is the important piece about these housing programs. Get people off the streets, get them the pieces that they need in terms of supports, give them voice and allow them to access services. So he's also connected to other United Way funded programs such as Thrive Counseling and Stride and other access programs. So he's very unique, and it's the mentorship piece now that he gives back to the other residents in this house. So there's many other impact stories. There's so many other highlights. There's definitely some lowlights, but at the same time too, we all work together, and the residents play a really key role in providing that kind of peer support and through their struggles and what works and navigating through their coping strategies. So I thank you for allowing me this time.
Just to finish off, I want to thank everybody around this table for all your work. Without the vision of United Way and their work around feed and root funding in terms of these new streams, and that vision and the way that they collaborate within the community and provide the front end of innovation around a lot of the pieces and the funding for us, in the past and moving forward, we wouldn't have the funds to be able to do what we do and have the vision that we have as well. So just want to thank everybody that the funds that you're raising go directly with the agencies to help some of the most marginalized and vulnerable people in our communities. And without that support, we wouldn't be able to do what we do. So we just want to thank you so much for helping to fundraise and for the campaign work that you're doing.